If you're over 60, there's a quiet health mistake happening in millions of homes every single morning. Have you noticed subtle changes lately? Numbness in your fingers, unusual fatigue, dizziness, or medications feeling stronger than they used to? Most seniors brush these off as just aging, but in many cases, they're not. There's a serious health mistake many well-meaning people over 60 are making every single morning without realizing it. It happens right after breakfast, right next to the pill organizer. In 2024, a massive study published in JAMA Network Open, tracking nearly 400,000 older adults, found that routine vitamin use did not reduce deaths from heart disease, cancer, or age-related illness. Even more concerning, researchers warned that unnecessary supplementation in seniors may actually increase health risks instead of preventing them. And this is why that matters. After 60, your body no longer handles vitamins the same way. Absorption slows, clearance weakens. Excess nutrients don't pass through, they accumulate. What once helped you can now quietly interfere with medications, strain your liver and kidneys, and trigger problems that look like normal aging but aren't. Please don't skip this video. Missing even one part could mean overlooking something that directly affects your heart, your nerves, or your bones. In the next few minutes, I'll reveal 4 very common vitamins that can become harmful after 60, and why understanding this now could protect your health for years to come. And stay until the end. The final one is the most surprising, and it's still being recommended to millions of seniors today. This warning isn't based on opinions or internet rumors. It's grounded in decades of medical research on how aging bodies respond to supplements. According to Harvard Medical School, as we age, the liver and kidneys become less efficient at clearing excess vitamins from the bloodstream. That means nutrients that once passed through harmlessly can now accumulate and cause toxicity, especially fat-soluble vitamins. The Mayo Clinic has also warned that high-dose vitamin use in older adults increases the risk of drug interactions, bleeding problems, nerve damage, and heart complications, often without immediate symptoms. And research reviewed by the National Institutes of Health, NIH, shows that several vitamins commonly taken by seniors provide no added benefit when dietary needs are already met, while significantly raising the chance of side effects within weeks to a few months. These findings are consistent across multiple long-term studies involving tens of thousands of older adults. In other words, this isn't about fear. It's about understanding how your body truly works after 60 and why more is no longer safer. Let me ask you something. Have you noticed more tingling in your hands or feet lately? Unusual fatigue that doesn't make sense? Or medications that suddenly seem to cause stronger side effects than before? If so, you're not imagining it. According to the National Institutes of Health, older adults are far more sensitive to excess vitamins because aging changes how the body absorbs and clears nutrients. And here's the frustrating part. Many seniors assume these symptoms are just aging. Often, they're not. This affects millions of people over 60 quietly and gradually, and it's rarely discussed during routine doctor visits. In just a moment, I'm going to walk you through 4 specific vitamins that can quietly become harmful after 60. These aren't rare supplements. They're some of the most common ones seniors take every day. We'll go step by step, starting with the least dangerous and working down to the one that causes the most serious long-term damage if left unchecked. And please don't skip ahead. The final one is the most important, and it's something many doctors still recommend without explaining the full risk.
If this information helps you, consider subscribing. It helps us reach more people who deserve clear, honest health guidance. Now, let's begin. Vitamin number 4, vitamin B6, pyridoxine. Vitamin B6 is often called a nerve support vitamin, so it sounds safe, even helpful. But this one surprised even researchers. Many seniors take B6 daily, either on its own or hidden inside B-complex supplements, believing it protects the brain and nerves. In reality, too much B6 after 60 can do the exact opposite, and the damage can happen slowly without warning. And once it starts, it's not always reversible. What happens inside your body? Vitamin B6 is water-soluble, but after 60, the kidneys clear it much more slowly. Excess B6 begins to accumulate in nerve tissue, especially in the hands and feet. Think of your nerves like electrical wires. Too much B6 strips away their protective coating. That leads to tingling, burning, numbness, balance problems, and in severe cases, difficulty walking. Many seniors assume this is normal aging, but it's not. Walking more won't fix it. Stretching won't fix it. After age 60, the risk of B6-induced nerve damage rises sharply, especially when supplements exceed what the body actually needs. Clinical evidence is very clear here. A 2020 study published in the journal Nutrients reviewed cases of vitamin B6 toxicity and found that long-term supplementation, even at doses once considered moderate, caused sensory neuropathy in older adults. Symptoms often appeared within 6 to 12 months and worsened with continued use. The mechanism is clear. Excess B6 overstimulates sensory neurons, leading to nerve degeneration rather than protection. Here's the key point. Most seniors already get enough B6 from food alone. The body does not need high supplemental doses, and it has no safe storage system for excess B6 over time. Here's exactly what to do. First, check your supplement labels. If you're taking a B complex or multivitamin, look for vitamin B6 listed as pyridoxine. Second, avoid supplements providing more than 10 to 20 milligrams per day unless specifically prescribed. Third, get B6 naturally from food instead. Chickpeas, potatoes, bananas, whole grains. If you already have numbness or tingling, do not ignore it. Talk to your doctor before continuing any B6 supplement, especially if you're taking medications for diabetes or nerve pain. Now, vitamin B6 alone can cause nerve damage, but it's not the most dangerous one on this list. Up next is a vitamin many people take for their heart, their skin, and their immune system, yet research shows it may actually increase the risk of serious complications in older adults, and most seniors have no idea it's happening. Vitamin number 3, vitamin E. Vitamin E is often marketed as a heart-protective, anti-aging antioxidant. Many seniors take it daily believing it keeps blood vessels flexible and the heart strong, but this one raises serious red flags after 60. What most people don't realize is that supplemental vitamin E behaves very differently in an aging body than vitamin E from food, and that difference can quietly turn protection into risk. What happens inside your body? Vitamin E is fat-soluble, which means it doesn't flush out easily. After 60, metabolism slows, and excess vitamin E begins to accumulate in fatty tissue and the bloodstream. Vitamin E also acts as a blood thinner. In younger adults, that effect is mild, but in seniors, especially those taking aspirin, blood pressure drugs, or anticoagulants, it can increase the risk of internal bleeding and hemorrhagic stroke. Think of your blood like a river. A small amount of thinning helps flow. Too much weakens the banks. That's why walking more or balancing with other supplements doesn't fix this. The problem isn't lifestyle, it's biological accumulation. Clinical evidence is very clear here. A large 2005 meta-analysis published in Annals of Internal Medicine examined data from 135,967 participants across 19 randomized trials. Researchers found that high-dose vitamin E supplementation was associated with a 7% increase in all-cause mortality, especially at doses above 400 IU per day.
More recent guidance from the Mayo Clinic confirms that vitamin E supplements may raise the risk of bleeding and interact dangerously with heart and blood pressure medications in older adults. The mechanism is straightforward. Excess vitamin E interferes with vitamin K-dependent clotting factors, weakening the body's natural bleeding control. This is why food-based vitamin E behaves safely, while pills often do not. What to do? First, avoid high-dose vitamin E supplements unless specifically prescribed. Second, check labels carefully. Many heart health or immune support formulas quietly include large amounts of vitamin E. Third, get vitamin E naturally from foods instead. Almonds, sunflower seeds, spinach, avocados. Food sources provide balanced amounts that the body can regulate. And if you're taking aspirin, warfarin, clopidogrel, or any blood pressure medication, never combine them with vitamin E supplements without medical guidance.
Now, vitamin E is risky, but the next one is even more deceptive. It's often promoted for vision, immunity, and anti-aging. Yet in seniors, excess amounts can weaken bones and increase fracture risk, even while people believe they're protecting themselves. Vitamin number 2, vitamin A, retinol. Vitamin A is often associated with good vision, strong immunity, and healthy skin. For decades, seniors have been told it's essential for aging well. But here's the problem. After 60, vitamin A stops behaving like a helpful nutrient and starts acting more like a slow-building toxin, especially when taken as a supplement rather than from food. And most people never feel it until damage has already begun. What happens inside your body? Vitamin A is fat-soluble, meaning it gets stored in the liver and fatty tissues. As we age, the liver's ability to regulate and clear excess vitamin A declines significantly. Think of your liver like a storage closet. When it's young, it stays organized. Over time, it gets overcrowded. Excess vitamin A begins to interfere with bone remodeling, weakening bones instead of strengthening them. This dramatically increases the risk of hip fractures and spinal fractures in older adults. And unlike calcium loss, this damage happens quietly. No pain, no warning, until a fall causes serious injury. Exercise alone won't prevent this. More supplements won't help. This is a clearance problem, not a deficiency problem. The science here is well established. A long-term analysis from the Harvard Nurses' Health Study involving over 72,000 women found that participants with the highest vitamin A intake had a 68% higher risk of hip fractures compared to those with moderate intake. The risk was linked specifically to retinol from supplements, not food sources. The National Institutes of Health, NIH, also warns that chronic vitamin A excess can cause bone thinning, liver damage, and increased fracture risk, especially in older adults whose storage capacity is reduced. The key distinction: vitamin A from animal-based supplements behaves very differently than beta-carotene from vegetables, which the body converts only when needed. Exactly what to do. First, avoid supplements listing retinol, retinol palmitate, or retinol acetate, unless prescribed. Second, be cautious with multivitamins. Many contain vitamin A doses far above daily needs. Third, get vitamin E safely from food. Carrots, sweet potatoes, spinach, kale. These provide beta-carotene, which your body self-regulates. And if you've had bone density loss, fractures, or liver concerns, discuss vitamin A intake with your doctor before continuing any supplement. Vitamin A can weaken bones, but the next one affects something even more critical. It's widely recommended for bone health. Doctors still suggest it, and millions of seniors take it daily. Yet research shows this supplement may actually harden arteries instead of strengthening bones. Vitamin number 1, calcium supplements. This one shocks most seniors because it's been recommended for decades. Calcium supplements are almost universally associated with strong bones.
Doctors suggest them. Friends recommend them. Many people over 60 take them every single day. But here's the truth. Calcium supplements do not behave the same way in an aging body as calcium from food. And in many cases, they can do serious long-term harm. This is the one that changes everything. What happens inside your body? When calcium comes from food, it's absorbed slowly and used where it's needed. But calcium from supplements enters the bloodstream all at once, creating sharp spikes in blood calcium levels. After 60, the body struggles to direct that calcium into bones efficiently. Instead, excess calcium often gets deposited in artery walls, heart valves, and soft tissues. Think of it like pouring concrete into plumbing. Once it hardens, flow becomes restricted. This process is called vascular calcification, and it increases the risk of heart attacks, strokes, and arterial stiffness. Walking more won't fix this. Taking more vitamin D won't fully fix it. This is a distribution problem, not a deficiency problem. One of the most cited studies on this comes from Johns Hopkins University. A large analysis published in 2016 involving over 2,700 adults used advanced imaging to examine calcium buildup in arteries.
Researchers found that people who used calcium supplements had a 22% higher risk of coronary artery calcification, while those who got calcium from food did not show this increased risk. The conclusion was clear. Calcium from supplements behaves differently than calcium from food. As we age, the body loses its ability to properly regulate sudden calcium surges. Excess calcium bypasses bones and settles where it causes damage. This is why some seniors with high calcium intake still develop osteoporosis while also increasing cardiovascular risk. What to do instead? First, stop relying on calcium pills unless your doctor has identified a true deficiency. Second, focus on food-based calcium. Yogurt, sardines, leafy greens, dairy or fortified alternatives. Third, support calcium placement, not just intake. Gentle weight-bearing exercise, adequate vitamin D from sunlight or low-dose supplements, magnesium-rich foods. If you've had heart disease, kidney stones, or vascular issues, calcium supplements should only be taken under direct medical supervision. Now you know the 4 vitamins that can quietly damage health after 60. Vitamin B6, which can damage nerves when taken in excess. Vitamin E, which can increase bleeding and mortality risk in older adults. Vitamin A, which can weaken bones and raise fracture risk when stored in the body. And calcium supplements, which may harden arteries instead of strengthening bones. None of this is speculation. These findings are backed by long-term research from institutions like Harvard, Johns Hopkins, the National Institutes of Health, and studies published in journals such as JAMA and Annals of Internal Medicine. The takeaway is simple but powerful. After 60, your body plays by different rules. You don't need to panic, and you don't need to throw everything away today. Start with awareness. Review your supplements. Question what you're taking and why. Begin with just one change. I recommend starting by eliminating unnecessary high-dose supplements and focusing on food first, movement, and medical guidance. Try this approach for the next 30 days and pay attention to how your body responds. Many seniors notice improvements faster than they expect. Now I'd like to hear from you. Which of these vitamins surprised you the most? Leave a comment below. Your experience may help someone else. If this video helped you, please subscribe. We share new, research-based senior health insights every week. And be sure to watch our next video where we reveal which supplements are actually safe and beneficial after 60. Remember this, it's never too late to protect your health. Your body is designed to adapt, repair, and strengthen even after 60.